everyone, and welcome back to another episode of Seniors Blue Book University. I have the pleasure of sitting down with Lauren today, and she's going to talk to us a little bit about MediConnect, and I'm very excited. Lauren, thanks for being with us today.
Thank you so much for having me, Heather. I'm excited.
Great. Tell us a little bit about your role and what kind of led you to the industry.
Absolutely. So my role here at MediConnect is I'm an associate manager. So what I do is I help train the agents that are out there visiting with our consumers, as well as just any kind of events. I'm really kind of trying to up our presence in the community as well. So just a lot of different hats I'm wearing right now.
Fantastic. And what were you doing before that kind of led you to where you are right now?
So I've been in the insurance industry since 2012. So I started as a temp actually at a health insurance carrier, worked there for about 3.5 years and went to another carrier. So I worked at the health insurance companies for most of my career. I came to MediConnect in March. I was ready for a career change. And whenever I was trying to figure out what I wanted to do next, I had known agents working in the industry for my entire career. So they were the first name that popped into my head. I gave them a call and we sat down, had a conversation, and here I am. But I really truly made that decision because I wanted to be somewhere that really coincided with the way that I feel the market should be ran, leading with education and doing the best for our consumers. So what's in their best interest, not what's in the best interest for the companies. So really, we have the same mission statement and it aligned well, and I'm here and very happy about it.
That's awesome. What would you say is different about MediConnect as opposed to other companies in the industry?
So first and foremost, we take a broad educational approach. We have weekly seminars. Every week we'll be in a neighborhood near you. So you can go to our website and check out the seminars tab. But we really, really feel the benefit of starting with education, explaining how Medicare works because it is really confusing, and then going from there. And we break down the different types of plans for you. So in Allegheny County alone, there are 49 different Medicare Advantage plans. That's a lot of research to do. So we have the certifications and we have to remain licensed and be experts in those plans. So instead of you yourself researching 49 different plans, we can sit down and compare those and help you decide what's best for you. We do a lot of education within the community, as well as we host a radio show every Saturday morning on KDKAM at 9 o'clock. So again, we're out there spreading the word about Medicare and really just helping to educate those consumers.
And I come from senior living, so I work with seniors on a day-to-day basis, and they have so many other things to worry about besides their insurance plan. So I'm sure this is a big relief for them, for someone that can come in that has the knowledge and can kind of compare and contrast their plan. And before this episode, you and I were talking a little bit about why someone might want to reevaluate their plan. Could you talk to us a little bit about that?
Absolutely. So we're coming up on what is called annual enrollment period. So October 1st through December 7th every year, those folks that are actually already enrolled onto Medicare have the opportunity to change their plans. So we meet with a lot of people, and we don't just work during the AEP, right? We're out there all year round educating and helping people understand, the benefits that are out there for them. And there's two big reasons why you want to reevaluate your plan during this time. Number one is that the plans change. So every year you're going to get a letter in the mail. It's called your annual notice of change in September. And that tells you what changed for your plan. But what about the other 48 plans or however many plans are in your county that are out there, right? You don't know how their benefits changed. Also, we change, right? Our health needs change. So what if you had a different medication prescribed? Maybe that plan that you're enrolled onto did fit you well, but there were changes and you're having more copays, more procedures done, different medications covered. So really it's important to reevaluate for those two reasons. And even though the plan benefits change, sometimes we even have new plans that come into the area. So we're starting to get the first looks actually for the plans, which we're not allowed to talk about till October 1st. But I can say there's a lot of big benefits coming through, right? more in the way of coverage, and maybe even, potentially different plans, and those plans are going to change. So if you're not taking a look at what's out there, you're truly doing yourself a disservice, and we want to make sure that you're covered right. So even throughout the year, as we're doing appointments, we see a lot of misinformation out there. There's those 800 number call-in lines, right? We're local. We're right here in your backyard. And also, we see people on the wrong plans, right? Where maybe the medications that they're taking are just covered stronger by another plan. Maybe a doctor is not in network that they need. So we're really just kind of sitting down, reevaluating that. And there's no cost ever for our services or obligation. So we're happy to come out and meet with you, review that plan. And if you're in a place that's a great fit for you and you're happy, we're going to tell you to stay there as well. So, it can't hurt to give us a call and have us reevaluate that plan for you. And like I said, we're coming up on that annual enrollment period, so we're going to start getting busy. So if you want to give us a call today, feel free, 888-818-6334, and we can get you on our calendar for the beginning of October when these plans are out there and we're allowed to talk about them.
That was great, because that was going to be my next question is there a cost to speak to you guys, or have you guys come out and talk to them?
No cost, no obligation, just good information is what our commercials say. And it's true, right? So we're out there, we get compensated by the carrier. So we want to fit you in a plan that's going to fit you the best, right? So that you continue to be enrolled on that as well. But we won't charge a fee for any of our services. And we help people. There's a lot of benefits out there, medical assistance, PACE and PACEnet in the state of Pennsylvania that help with prescription drugs costs. For a lot of people, we'll help them apply for that. There's a lot of different caveats that we do when we get into the home and we kind of see your situation as well.
That's amazing. Lauren, thank you so much. This is a lot of fantastic information. I know it's going to help a lot of seniors as well as their caregivers and their family members. So I really appreciate it. And I look forward to speaking with you again.
Sounds great. Thanks so much for having us, and give us a call. We'll be happy to help.
Thanks, Lauren. I appreciate it.